Hepatitis is a medical condition characterized by inflammation of the liver, an organ essential for numerous metabolic processes and detoxification in the body. The term hepatitis derives from the Greek words for liver, hepar, and inflammation, itis, and the disease can manifest in both acute and chronic forms. The discussion on hepatitis requires an academic approach due to its public health significance, diverse etiologies, and clinical variations. Hepatitis may result from various causes, broadly classified as infectious and non-infectious. The most common infectious causes are viral agents. There are at least 5 primary hepatotropic viruses, designated as hepatitis A, B, C, D, and E viruses, HAV, HBV, HCV, HDV, and HEV respectively. Each virus exhibits distinct modes of transmission, epidemiological patterns, and clinical outcomes. For instance, hepatitis A and E are typically transmitted via the fecal-oral route, commonly associated with contaminated water or food, leading to sporadic outbreaks or epidemics. In contrast, hepatitis B, C, and D are primarily blood-borne, transmitted through contact with infected blood, unprotected sexual intercourse, or from mother to child during childbirth. Non-infectious causes include excessive alcohol consumption, which leads to alcoholic hepatitis, drug-induced liver injury resulting from exposure to certain medications or toxins, and autoimmune hepatitis, wherein the body's immune system erroneously attacks liver cells. To a lesser but noteworthy extent, metabolic diseases or genetic conditions, such as Wilson's disease or hemochromatosis, may also provoke hepatic inflammation. The different types of viral hepatitis warrant particular attention due to global disease burden. Hepatitis A typically causes acute self-limiting illness without chronic progression. Hepatitis B and C are of public health concern because they frequently lead to chronic infection, which may culminate in cirrhosis or hepatocellular carcinoma over time. Hepatitis D, an incomplete virus, requires co-infection with hepatitis B virus for its replication and is associated with more severe outcomes. Hepatitis E, like hepatitis A, generally runs an acute course but is notably severe in pregnant women. Clinically, symptoms of hepatitis range from asymptomatic forms to severe manifestations, including jaundice, fatigue, anorexia, abdominal pain, dark urine, and elevated liver enzymes. Diagnosis often relies on serological and molecular tests to identify viral markers, autoantibodies, or signs of hepatic dysfunction. Treatment strategies are type-specific. For example, antiviral medications are crucial for chronic hepatitis B and C, while supportive care suffices for acute hepatitis A or E. In conclusion, hepatitis encompasses a spectrum of liver diseases with varied causes and types. An understanding of its etiological diversity, modes of transmission, and clinical management is necessary for effective prevention, prompt diagnosis, and optimal treatment. Global efforts in vaccination, notably against hepatitis A and B, safe injection practices, and public health education remain central to controlling the burden of hepatitis worldwide.